Hey, what's up, everyone? It's Dr. Glenn Vo, and I am super excited to have not just anybody. This is actually the president of GermFree Innovations, Mr. Jay Baum. Jay, welcome to the show.
Thank you, Glenn. Appreciate it.
Well, I was super excited to bring you on because your partner actually had reached out. Well, before I go any further, let's talk about GermFree Innovations. Let's talk about how you guys got into the dental space and what kind of products you guys carry.
Okay, I'd be happy to do that. Well, we are a company that has what could be considered a pretty radical, fairly new technology that's new but not really new. I will describe what this is, but it's in the field of antimicrobials. I've been involved personally in the field of dentistry since 1994, believe it or not. So a pretty long time. So that was in the era of software and the migration of computers into operatories, digital radiography, cameras, imaging systems, patient practice, or patient management systems. One of our partners is a gentleman named Bill Hunsinger. He's a dentist in Ohio. Another one of our partners, Mark Bly, was actually had owned IT companies in the field of dentistry. So that's how I became acquainted with them in years past. But we know the field of dentistry, and we know it well, and the pressures of everyday life, especially as time has gone by and we are where we are today. I know your organization is a lot about trying to protect and help the average solo, multi-man practice, multi-woman practice survive in this day and age of corporate dentistry. So we're really targeting right now in this discussion the whole field of infection control. And so the fact that we've been doing this so long, I can say that probably all would agree that in infection control, as far as what you use chemicals, what you treat surfaces with, what you apply to your hands, has really not changed in the last 20 or 30 years, has it?
No.
I don't want to really name brand names, but I'm not necessarily taking a shot at brand names, but everything that is being used today to treat what I just mentioned is chemical based. So we're talking about strong commercial grade chemicals that are a combination of ammonium quaternary technology along with alcohol peroxides. The biggest complaint we've heard for years is that you buy all this expensive equipment and over time it is very caustic, degrades the quality of materials, it turns plastics yellow.
Yeah.
And then the other thing too that we know is the exposure that the staff has to these chemicals, especially dental assistants. And those that know the risk that they have and the warning labels that you see on these products, I mean, if you were to look at the safety data sheets, they're a little scary about the toxicity. When you're applying, whether it's wipes, sprays, combination of it, you apply it and you should leave the room and not breathe in the fumes, because all of these chemicals are killing microbes as it dries. And you're also wearing, of course, gloves, disposable gloves. Even there is some conjecture that the normal gloves may not be enough protection with those chemicals for long periods of time. So the chemicals work. They have high, fast kill rates, but they're toxic. But the biggest thing that we're going to talk about today is once you apply them and they dry, there's no lasting residual effect. So 5 minutes after something dries and you start doing work, you start doing your dental procedures, hygiene, soft tissue, restorations, etc., you are exposing the room to microscopic matter that does contaminate all the surfaces again. And that is the biggest comparison we'll make today, is that conventional products, chemical kills, kill quick, but no residual effect. The products we have are mechanical kill. They make a nano bond on all surfaces, even our skin. We have skin products, and they last not only hours, but on the surface protectant, up to about a month.
Really?
You'll still clean between patients, of course, and disinfect.
But it's just an extra level of protection there.
It is not only an extra level, but this is a disruptive technology. It will replace conventional chemicals eventually as the world takes it on. You can use it just like you use the products you're using now, between patients, wipes, sprays, all the surfaces. And it is a water-based silica product that is not toxic. It, if you get on your skin, it's not really going to harm your skin. You can put it on all surfaces, including your chairs, leathers, vinyls, anything that's even non-porous or porous. All surfaces it will go on, and it creates a nanobond.
Wow, that sounds amazing. Guys, for those who are watching right now, if you like what you're hearing right now, type in the comment section, germ-free. And also, if you want a Nifty deal, go ahead and show us some love. Type in the comments there. And also send some questions too. Type in the comments. But also, if you have any questions, feel free. If you don't want to be, you don't want your name out there, you can message me. I have my other screen up right now. In fact, we have a couple of questions already. So Jay, can I throw some questions at you? We got some questions.
Please do.
So this doctor's asking that, is there any studies with your products? Which
yes,
you're in a group full of dentists. They're always going to want to know, right? I'm sure your partner was really adamant about that. Like, hey, these guys are going to always want to know the literature. So, is there any research that you guys can offer for people who are interested?
Absolutely. So. Let me just talk very quickly about the technology in general.
Sure.
We just talked about chemicals. So this particular technology was actually discovered by Dow Corning about 40 years ago. And the question then is, well, where has it been?
Yeah.
Why are we just seeing this now? Well, we're not just really seeing it now, but what happened is with so much in terms of intellectual properties, discoveries, and so on. An investigator makes a discovery. They prove their theory, but then often there's no R&D money behind it. So really this technology, this concept kind of sat out there for about 25, 30 years. It's only been in about the last dozen years that companies have started putting R&D money toward it. And what it is that the ability to create a nanobond, a polymer on a surface. We have videos of it. Our website, GermFree Innovations, has a lot of the studies, a lot of the clinicals, all the different microbes we can kill, and we kill all the bad stuff, all the bad. Because here's what it does. So anyway, let me back up. So in about the last dozen years, there have been companies that have put money into it, including the parent company that we are the extension of sales marketing for, called ESD Brands. ESD Brands is an international company. We sell all over the world, all over the country, and they have all the patents, the science behind it, the R&D, and conduct all the studies, or we have all the studies through them. Okay, they don't do the studies; they're done by independent labs, of course. But so anyway, what happened is in the last dozen years or so, especially with the real growth and fear of superbugs. Let's face it: the more chemicals we pour on these bugs, the more resistant they become. Why is it the CDC says you have to use at least 70% isopropyl alcohol? It's not because it's so great. It's taking more and more alcohol to kill the bugs. Okay. So what we do is in this technology is, and there are a few other companies that have it, although we've got, if you might expect me to say, the most advanced molecule. Our product is water-based. It forms a silica polymer. If you've ever used anything like Rain-X on your car windshield or wax, it's like that. So it makes this microscopic molecular bond. Okay, we call it covalent bond, like paint drying. It dries to the surface. It makes a polymer bond of silicon. Okay, just like Rain-X. But what happens is bound in this polymer are all these carbon chain spikes, or really nitrogen compounds, and they come up and they're little spikes. They have a strong positive charge. They pull all microbes to them, bacteria, viruses, fungi, et cetera, because as you know, they have a negative charge. So you got positive, negative attracts, and they literally electrocute, explode, pierce, and destroy all the molecular matter, but it stays there. And what's interesting is if you take the same type of chemicals you have in a lot of your strong disinfectants used in dentistry, I'm not going to name the one I'm thinking of, but everybody knows it. Okay.
Does that happen to be in a canister?
Is there any canisters and spray bottles? You got it. Okay. So when you apply this, what it has in it is something called quaternary ammonium.
Mhm.
Okay. Now imagine if you could put that down and it stayed wet for a month. It would still be killing, but
Yeah.
it doesn't stay wet for a month, does it? That's what we have. We have the same quaternary ammonium, okay, molecules embedded in this polymer, which makes it, it's bound inside this polymer. I'm getting kind of scientific because you all are scientific.
Oh yeah, and
But
this is exactly what people want to hear.
it has this tremendous positive zeta potential, draw, pull. It's like the little kid blowing bubbles out over their yard, and the little bubbles are pulled down the grass and it just explodes them. We have electron microscope in our R&D lab in Greensboro, North Carolina. We can actually see this. Okay, so it just explodes and pierces and electrocutes all microbes. So it's a highly effective against all viruses, bacteria, fungi, etc. So studies, that was the question. Yes, there's over 50 studies we have on this. As a matter of fact, since the only disease that's out there right now seems to be COVID.
Yeah.
At least that's what it seems like. We have some really landmark studies on COVID now. So I'm really now talking about a technology that we call Zetracil, which is a registered trademark name that means zeta potential, positive magnetic charge, tri, it's a tri-kill, attraction, piercing, shocking, and sil is silicon based. So it's just like what you use in dentistry in the liquid, but it's not a chemical kill. It becomes part of the polymer. It's bound in the polymer, so it's safe. But it has this tremendous killing power. Our hospital grade kills at 99.9999% 6-log.
Wow.
Surface protectant at 5-log kill. So when you put it down, so as far as studies, let me just give you an example. We have studies that show the kill rates. We name all the bacteria viruses. We have all the superbugs on there, even things like C. diff, which, by the way, alcohol does not kill. And all these hospitals using C. diff, using alcohol all the time. They're not killing one of the superbugs they're really worried about.
Yeah.
We kill norovirus. We kill all the bad stuff. Now let's go to COVID. So on COVID, on the surface sanitizer that we have several studies being conducted by the University of Alabama at Huntsville. I can send you copies of them. We've got links to it. One of the leading investigators in the United States, her name is Dr. Deborah Moriarty. She does a lot of the training for GLP labs for the EPA. She's highly recognized. In several studies, we've tested different variations of our Zetracil-based surface protectant. On the standard surface sanitizer, we kill COVID day 1, day 7, 14, 21, 30 days. That means, and this is on stainless steel plates. So and again, being in the scientific community and the knowledge of dentistry, stainless steel is very hard to adhere to. So that means that and all the testing that's being done by all these labs is pretty much a surrogate virus that is stronger than the SARS-CoV-2. Mm-hmm. We actually have it going against SARS-CoV-2 now, but it's the acceptable, clinically acceptable surrogate virus, okay, for COVID-19. And this is what the EPA considers too. So on our surface sanitizer, we kill SARS-CoV-2, we kill the COVID-19 virus day 1 at 99.99%, 2 weeks later at 99.99%, 30 days later at 99.99%. That means, yes, and that is the product. That's actually the food grade right there, but it looks like that. So when it's applied, that means that going back and applying the virus to a surface that had our surface sanitizer, the MyShield brand, I'm glad you put that up there, the MyShield brand surface sanitizer, 30 days later, we still kill it at 99.99%. They then took 2 more studies out to 90 days, and we still had kill rates of 99.9% and 99.95% 90 days later. So in dentistry, you're not gonna do it once a month, obviously.
Yeah, no, you're not. I mean, that's amazing because the amount of time, but no, we're constantly cleaning the room. So it's never going to be like that where we just clean one time for a month. So let me go ahead and.
Sure, yes.
Okay, is that the right one?
That is laundry. So, but I'm glad you have it up. Let me talk about that.
Sorry,
So,
I got a bunch of pictures from your team, and I'm pulling up the wrong ones, so I apologize. But guys, just to let you know, there is a medical grade one. I'm the one who's goofing up here and putting the wrong ones. But the container looks the same. Did I at least get that right?
Yes, it looks the same. So that is actually the laundry product. Now, in the laundry product, this is going to be a huge product because once again, Zetracil based. It's optimized for clothing. It can be used in the rinse cycle of wash. So if you're washing scrubs, etc., it applies a nanobond to the scrubs. We have testing that goes all the way out with a biostatic protection, not the super high kill rate, but biostatic protection all the way up 200 days right now. But we still have COVID testing of 99.99%. And it applies that nanobond protection to clothing. Then the hospital grade is the strongest brand of it, and it's going to be either the surface or the hospital grade that you would use in dentistry. The hospital grade is the strongest and is the one that has the quickest kill rate, even for TB.
All right, let me make sure I got the right one now.
That's hospital grade. Yes, it is. Yep. That's correct.
Okay. So, I mean, there's so many amazing products, guys. I mean, and we're gonna get into more of the products, but Jay, we got more questions. You opened up a big, you open up Pandora's box here, and so this doctor's asking, is there residue when you're using the products on your hand? Because as you were saying, that it doesn't go away, it kind of stays around. Is there residue that someone can feel on their hands if they use the hand sanitizer? This person did their homework. They went straight to your site. Using your hand sanitizer, is there going to be like a film or a residue on your hands?
Yes, good question. So on the hand sanitizer, yes, there is. But what it is, it's this polymer nanobond. Now, with a hand sanitizer, obviously it is optimized to be on hands. It is a foaming. We have a foaming product and a gel. The foaming is used the most. So the foaming product has, once again, Zetracil in it, water-based. It has aloe vera in it, and it dries it doesn't dry quite as quick as alcohol, but it's still fast enough that if you apply a shot to your hands. Now, for example, this is interesting. It's a great question. If you were using this in dentistry, we would recommend using the dispensers because they're the cheapest. It's about 1 penny per shot, 1 cent. So you walk in, stick your hand under the dispenser, it dispenses onto your hand. Now, the effective kill rate we have, it only requires 0.3 ml to be sufficient enough volume. Alcohol requires at a hospital level 1.25 ml, over 4 times as much. So alcohol dries faster, but you got to put more in your hands. So our dry rate is fast enough that you'll be able to glove up as soon as you want to. But yes, it does make the nanobond on your hands, but I will tell you, it leaves your hands very soft and soft feeling. Alcohol dries your hands out. Mm-hmm. And once it's dry, again, it's not creating any type of long-lasting protection. But yes, it does leave the residue. You can't see it, you can't feel it. Your hands just are left feeling very soft and silky. We also have COVID rates on that of 30 seconds. Now, what we use in the hand sanitizer is not the same ammonium quat structure of like the strong surface. We use, but we still have a 5-log kill. We use benzalkonium chloride. Alcohol, isopropyl, and benzalkonium chloride are the 2 leading contenders in the marketplace now for antiseptics used on skin. But we use benzalkonium chloride a little different. So we've got quick kill rate, 30 seconds, COVID with the hand sanitizer. However, that BZK becomes part, again, of the nanobond structure. That's kind of the ammonium quat structure for your hands. So it's very safe.
And I guess I have a follow-up question from another doctor. They want to know, when you're applying the hand sanitizer, how much do you need to use? Is it just like a pea size, or is it just if you're using? I put up well, I have the soap there, but I guess they're talking about this pump bottle here. Is it 1 pump and that's plenty?
So the soap bottle, yes, the soap bottle you have up there is an 8 1/4 ounce consumer level, and it can be used really anywhere. But as I mentioned a minute ago, if you're using this like in dentistry, and every time one of your caregivers walks into a room and you're shooting it into your hand, by far the most economical way is the bags. The bags are 40.5 ounces. So 1,200 ml, you get about 3,000 shots out of one bag. So it's about 1 penny per shot. So it dispenses the correct amount into your hands and is ample. And the nice thing is too, remember that every time I put this on my hands, I'm not drying my hands out. Alcohol is not good for your hands. And I'm still getting an nanobond. We have clinical testing on our hand sanitizer too. It kills all the bad superbugs. On our hand sanitizer, we have long-lasting residual kill rates for up to 4 to 6 hours after one application. Now, that doesn't mean, again, you're putting it on every 4 hours. We even have a level of about half of the protection even at 24 hours, but you would just put it between patients. Everything that you do today in terms of your whole comprehensive infection control with hands, surfaces, you would do the same with the sprays, wipes, etc. It's just you have a non-toxic nanobond product that also makes up for mistakes where we maybe don't spray things or clean them adequately at times because we do have human error.
Hey, you know, I have another question here. We got a lot of questions here. So Jay, just humor me here. Good. We got another question here.
I'll try to shorten up the answers.
Yeah. And this doctor wants to buy these products for their home. And hey, I actually want to do the same thing as well. And how are these with kids with sensitive skin? Is it safe for these kids?
Absolutely. So again, it's a non-toxic product. If I were to show you the safety data sheets on all of it, they have a toxicity rating of 5, which means non-toxic. Doesn't mean you're going to drink it or get it in your eyes, but they are very safe. And we do have, in fact, actually, if you look at the picture you have up there, the little bottle and the little kind of little hanger thing, that's a kids. That's the kids pack, gel pack of the hand sanitizer.
Oh, wow.
Yeah, very safe. We have a real big presence in terms of our retail store, Amazon. Amazon exploded on us about 2 weeks ago because there's an article written about comparing us to Perel and being superior because of the long residual effect, persistent effect. So yeah, we sell tons of it for home. Now it's interesting too because this picture you have up is a picture of a little travel pouch of sanitizing hand wipes, and we do have wipes also. Now these sanitizing hand wipes can be used on your bare hands. But guess what? We even have hospitals using this on surfaces because it has Zetracil. Wow. It's not the long 30-day kill, but it can be several hours. And you can use it with bare hands, and it's killing all these microbes I'm talking about, even like MRSA, C. diff, COVID.
Jay, let me ask you this question. Let's say when people start feeling comfortable and they're traveling, but they still want to be safe. Could you use those wipes to, let's say you're on the plane and wiping like the seat handles and wiping the tray when you're on the plane?
I would do that.
Yeah. And so with that, I mean, you said that you have coverage for at least a couple of hours, right? Which is better than the bleach wipes, which you said yourself, like once it dries, well, that's pretty much it.
Bleach is toxic. We have school systems actually using these wipes on school desks because everybody's so COVID crazy right now, and teachers are wiping down desks. And you know, it's funny. I even know of a local school here in Charlotte where we are, where they have the teachers wiping down with conventional like Lysol wipes. I'm not picking on Lysol, but at the same time, they're telling the teachers, wash your hands after you do this. Not good to have this stuff on your hands. And that's not correct.
Yeah.
And so, but these are meant for hands, but they do have the killing power. When it comes to the surface sanitizers in the hospital grade, the hospital grade too, usually we would dilute that at least 1-to-1. If you're using it like within a spray bottle and use distilled water, but you would still want to have on probably your gloves, but it's not going to hurt you like getting the other products on. There's nothing that's going to really invade your skin and really cause, potentially harm you. And also too, there's really not hazardous fumes emitted from it. Now, if we're spraying it with a fogger or something like that, we would wear goggles and a mask just because it's like a cloud.
Right.
But just spraying it or wiping it down, no.
No, I do have it. Now, this is a question for myself because I went through the website, and guys, I put right there, there's the link to the website. Go there. Under the resources, there's the studies as well. And of course, if you have any questions, you can always reach out to Jay. I'll put his contact information and company contact information. But here's the website. Go look at everything. And my question is, I see something for topical anesthetic. And I'm thinking I'm antiseptic, and I'm the topical antiseptic. I'm assuming that this is going to take the place of like a Neosporin for when the kiddos scrape their knees and whatnot.
I'm glad you asked about it, because I probably would have forgotten to talk about it. It's one of our best kept secrets. And once again, it's Zatracil. It's like Neosporin. It's a little gel. But the interesting thing about it once again, it has this tremendous healing power because it makes a nanobond. It continues to kill any type of bacteria or viruses. We actually had this product used by special forces in the Middle East.
Wow.
Okay, we have hospitals, dermatology using it. We have a couple of clinical documents I can send you on wound care, because and we actually are launching a study of, we've been solicited and are entering into a military study right now on this product. But, there's a lot of good topicals out there, and a lot of them that also have the benzalkonium chloride in it. However, once again, ours becomes part of the nanobond. What is interesting about it, Glenn, is that when you apply it, it almost becomes a little bit like, I don't want to call it glue, but when it dries, it kind of makes a little bit of
like a barrier,
almost like a glue, and it just stays there. And it's easy to wash off, but it has tremendous healing power. So it's an outstanding product.
And as someone with two young kids at home, they're always falling off their bike or doing something. And this is something that I would like, especially let's say if you're in the park or something, and you don't have a Band-Aid and you want to keep something clean, and that barrier, at least for until they can get home, would be something to kind of protect that area. And I can tell you right now, I mean, that's something I would be very interested in as a parent. And most of the doctors are watching right now with young kids. It makes sense that I love the fact that it leaves that little barrier, because that's the thing. You put a little Neosporin on, and then it just wipes right off unless you have a Band-Aid on it.
Well, thank you. Yes, that's a great point. And getting back to that whole idea is that, would you rather apply an alcohol-based hand sanitizer to your kids' hands when they leave for school, knowing that 5 minutes from now it's dry, and it's not doing anything, or put on a product like we have, like our MyShield hand sanitizer, and know that by the time they're coming home, they still have a pretty high level of protection on their hands?
Absolutely. It's a no-brainer. Now, I'm going to shift gears in a little bit here.
Okay.
Going back to the laundry product, I know I accidentally put that thing on, but I think it's really interesting to talk about because, number one, my practice, we have a washer dryer on site because my team likes to wash their clothes. They don't want to bring it home. But, there's been so many team members saying like, especially with COVID, they're worried about bringing their clothes in and put it in bags, and they want to make sure it's clean there. Talk about because I think that's really neat that you guys have a laundry cleaner here for clothes. Number one, talk about, everyone's going to wonder about this. Is it going to damage my clothes? Is it going to damage my scrubs? Is it going to be really harsh? Right. And then also, is it as strong? Like, will it get the odors out? That's another thing too. People are like, okay, well, it's not as harsh. Well, how do you get all the odors out from the dental practice and whatnot? So those two things: is it going to damage the scrubs, and is it going to get all the odors from the practice out of their clothes?
Yeah. Those are really great questions. And I'm glad you brought up odors as well, because when we talk about killing odors, what is it that causes odors? It's bacteria.
Yeah.
Right. So bacteria causes odors, so does mold, etc. We have a lot of hotels that have problems with mold, mildew, just moisture, very high humidity areas in the country, coastal areas that are using this because they can go in and fog like a hotel room and get kind of that musty smell away, because it gets on the curtains, on the carpet, and the upholstery, beds, etc. And they spray, and it has tremendous ability to take away odors. Now, on our service sanitizer, we actually conducted, and once again, I think we have this on our website. We had a study conducted by Boeing. Boeing does testing before they'll use any products on their commercial aircraft. And mainly what they're doing is they're not just testing the efficacy, because they'll look at your clinicals and say, okay, the stuff works. But would I take, for example, a chemical you use in dentistry? Would I be spraying it on airplanes all over the seats and the plastic handles on that you put your arms on and the metals? Would I spray it on there? Well, they're concerned about what's it going to do to all the materials in the plane over time. They're not cheap. So we did this study with Boeing. They have 11 criteria. They're looking at what is the effect on upholstery, carpet, plastics in the a lot of plastics in the planes, colors, does it change colors, metals, does it cause corrosion, and we passed all of them. So it's extremely safe to use on surfaces. That is the same molecular makeup that's used in the laundry, although it's not as strong, it's not as potent, but it is very safe to put onto your clothing, makes it very soft. And you don't have to do it every wash either. You could do it once a week, once every couple of weeks, because it does put that nano bond on.
Now, I want to ask you this, Jay, and I think you already brought this up, but someone had brought this question up, and I think it's worth asking again. And that is the issue with whenever we're cleaning our dental chairs, whenever we're cleaning the plastics that on our dental units, over time, it messes up with the with the vinyl on the chair. It corrodes whatever the ultra leather. It messes up all the plastic. That's something, and then it changes colors too. It looks like it makes your plastic look yellow. It looks like you haven't cleaned that chair in a while, which you do all the time. My question, and this doctor's question is this cleaner going to do that same thing to our chairs and our equipment?
Does not, because it has no alcohol. It's chlorine peroxide, alcohols, but especially chlorine and peroxides are what cause that. Mm-hmm. Okay, and so when you look at the commercial grade products out there, and the one you all use, probably 90% of dental offices around the country, and then there's a couple of knockoffs of it. It's a great chemical for killing. It is extremely potent. Has quaternary ammonium in it, alcohol. You also get it often where you have peroxides in some of these products. So it's a combination of chlorine and peroxides that cause that. We are water-based, silicon, these carbon chain spikes in as I said, the bound ammonium quats in the molecules of those spikes. So we don't cause coloration changes at all.
That's huge, because that is a topic that people bring up all the time. They're thinking of different ways to do that. And unfortunately, it's hard to get around that until now, guys. So look, guys, if you want a nifty deal, if you're excited about what you hear, because I'm actually excited about some stuff to use, to be honest, guys, at home, because I have two little ones. Yeah. I'm thinking about the hand sanitizer I've been sending my daughter off with. I'm about to change that right now with this product. It's going to give more protection. And of course, gosh, the antiseptic. I mean, come on, with the kiddos getting scrapes all the time, that's huge. And of course, all these things are in practice. Type in the comments section, guys, GermFree Innovations. Type in the comments section if you want that nifty deal. And speaking of nifty deal, Jay, I'm going to have to put you on the spot. I know you're new to this group, and I'm going to put you on the spot here. And look, we're always looking for great deals. We're looking to bring because as you know, in the dental practice, it's really hard. We're always against like corporate practices that have the buying power, and so we come together and try to level the playing field. And we're so excited to have you in, because number one, this is really safe for our practice, not only for our practice, for ourselves, but also it's so hard to find some of these cleaning solutions right now. Jay, right now it's like so hard. Everyone's just scooping out. There's always been a shortage. That's why I'm super excited to have you on. But I want to ask you, for our members here, if there is a deal that you can offer for us. You're in the Nifty Thrifty dentist, Nifty Thrifty. We like to save money. Let me ask you, Jay, we'll put you on the spot. Is there a deal you can give our viewers right now?
Yeah, absolutely. I think what we would want to do is talk kind of about corporately where we start.
Yeah.
We always say to people the good news and the bad news, at least for us, is the bad news is the whole world doesn't know about it yet. The good news is that's huge opportunity, and this is disruptive technology that is game changing. It should replace conventional chemicals. And I'm not talking about using, this to kind of put the surface protectant down and then continue using all the chemicals over it all the time. I mean, this can totally replace all of that. So the opportunity is extremely large. So yes, the answer is yes, we would. And currently right now, we have sales all around the world. We have all kinds, from schools to prisons to airports, about every sector of business we're gaining a real foothold now in medical. So we have about every avenue and walk of life you can imagine. We even have some major countries right now that are using it. We've got huge interest in the Middle East. So it's taking hold, definitely. Dentistry is really a huge interest for us, and especially our partner, Bill Hunsinger, because we know it so well.
Yeah.
And we know what you're up against, and we know the extreme demands that dentistry has on infection control. I think that's probably why dentistry's fared so well in this age of COVID. You're already used to doing this. And we know we can take it to a new level. Currently, we do not have product, although we've got some real interest in the big suppliers, the dental suppliers. But to be honest with you, that's fine, and we're interested in them, but we want to sell product. We want to forge into the industry. We know what's out there. We know what the opportunity is for you, for us. And so, yes, we would be willing to definitely make some buying group deals that could be on the surface products, on the hand sanitizers, the soaps, the laundry product, and so on. Now, let me just speak kind of and just inform your group so it can really give you complete information.
Sure.
On the sanitizer side for all skin, this is all FDA regulated. So on every Zetrasil product we have, so you've got pictures of it up there, on the sanitizing soap, especially the hand sanitizer, the wipes, topical, we even have body spray. That's all FDA registered, FDA regulated. Anything we put on surfaces is EPA regulated, okay? And so here's where we are with that. We are right at the final doorstep, or we're right at the doorstep of getting EPA registration on our surface products, our hospital grade, our surface sanitizer, and so on. Now, does the EPA designate that products work? No. Do they prove anything? No. Same with the FDA. They are government bodies, as you know, where you submit your data to it, you follow all the criteria that they request, you use the labs they request, etc. And all these products have all the studies. It is the clinical labs, the multitude of studies that we have that prove it. But right now we're in the final stage of EPA. We really think we're going to have it this month. We thought we would in December. Part of at least our conjecture is that it took longer than usual, even though the EPA is a difficult agency to work through, because we've just come through a very tumultuous election cycle. Yeah. And we also had COVID that blew up in the spring. So all these companies, including us, have been trying to do all the COVID testing, which we've got multiple studies on that now. So we expect it to get any day now. Now, that doesn't mean you cannot use our products on your surfaces. However, I'm just giving you the disclaimer right now. If you were to order it today, it's not EPA. It will be. It does work. If we have it tomorrow, it doesn't mean it works tomorrow. And it didn't work today, of course. All the claims are still the same. The claims are made by the studies, not the EPA. But we will have that soon. And as soon as we do, because right now we're waiting to make our label change on the surface products. And then we will have it in all the wipes, spray bottles that you'll really want to use in dentistry. For right now, we have available on the surface products, hospital grade, and the surface sanitizer, probably in the form you would use would be gallon jugs, pouring it into bottles and spraying it if you wanted to do that. So that's available to you.
But in the newer future, you said that you're going to have the actual wipes that a lot of people are used to.
Yes. So we will have the Zetrasil-based surface wipes that are EPA designated or registered. We'll have that in the very near future. And we're also going to have a whole line. We've got actually 4 different wipe products that are actually disinfectant wipes that are the exact same thing you have currently right now, the EPA peroxide, chlorine-based bleach, and then we'll have alcohol. And the interesting thing is there's not a single company that has EPA registered alcohol wipes.
Wow.
People don't know that, but there isn't. So anyway, with that said, I just wanted to let your group know that we can definitely offer, collective buying power that you have for any of our products, including Surface, pre-EPA, which we think will have EPA any day now, and then all of the FDA registered products. And at a minimum, if your group were to start looking at making a switch over to our hand sanitizer, that would be a very beneficial move. And of course, all can, if you want, we can maybe strike an attractive price on smaller bottles like the 8¼ ounce, the wipes, the hand wipes right now, just to let your members, evaluate and try them out.
No, Jay, let me ask you this. I mean, I know you were talking about the EPA, registration for the surface cleaners and whatnot, and then you were saying that FDA approval for the hand sanitizer. That means the hand sanitizer is ready to go. You guys already have FDA approval for that, right?
Oh, yeah, yes. And the interesting thing is you've got two government agencies, and one that we're putting it on our bodies. We have all of the registration numbers, approvals. And approval is kind of a loose word. It's registration is actually the correct terminology. So we have all of those. It's the EPA, which is really the Environmental Protection Agency, which is concerned about the environment. That is a real it's a real maze to get through the process with the EPA. Very long.
Well, Jay, we're super excited about that. Now, I want to ask you to promise us something though. Once you find out, once you get that registration and you got those other products, you got to come back and let us know, because there's so many people that I'm fine. What's funny is that I practice with my wife, and I'm fine with spray bottle, but my wife is really particular about the wipes. I don't know why. I was like, why can't you just? No, I just like the wipes, and I know some doctors are. So when you guys get that, you're gonna have to come back on. You got to promise me to come back on and talk about that. But I'm excited about all the products you have right now. I'm really excited with the antiseptic, topical antiseptic, hand sanitizers, because now if you think about it, it's almost before COVID. A few people had hand sanitizer. Now it's almost like carrying your wallet. Right? You never forget your hand sanitizer. And the fact that this new technology, well, it's not new technology. It's new to us, been around for a while. But with this technology, it makes sense because, well, we want that protection. We don't want a 5-second, 10-second protection. We want hours. So I'm really excited about that.
Absolutely.
Well, Jay, for those who want to order this, obviously here's, let me go ahead and put the website back on. Obviously, you can go to the website. Is that the best way to order the product?
Well, it's one of the ways. We do have partner resellers that we establish around the country that are companies that maybe they're in different vertical markets. Maybe they're cleaning services. Maybe they are transportation, etc. We have airports even like using this in transportation systems. So they also are resellers that are contracted with us. But yes, you can order directly from us on the website. And I'll tell you what we could do right away, and maybe offline, Glenn, we can set this up with you, is we can do a program where what we could do is we can do what's an affiliate type program buying group. And you can go in, we can give you a code. So everybody in your organization could go into our website, put into the cart what they want, and then put a code in and get a discount. And so let me talk with you offline, if I could, about that discount, but we'll make it worth it. So right off the bat, anybody who wants to order anything for home or even for their offices can get this discount, and we just ship right out of here to you.
I love it.
As far as the Surface products, if anybody out there does want to use them, there's nothing illegal about it or wrong with it. You just have to understand that right now we can make all the claims about the kill rates, the disinfecting power of our products. We just don't put that on the label. We call it cleaner, even though it's really a disinfectant. And that's just what the EPA requires as far as the regulatory issues that we have in our country. When we actually sell it all overseas, it says sanitizer on it. But for now, it says cleaner. So if somebody does want to use this, and put it down. Let me answer this. This is not a question that came up. So if there's anybody out there that says, wow, this sounds so fantastic, I'd like to spray my office once a day, once a week, whatever, in my operatories and so on, and have that protective nanobond, you can still use your conventional chemicals over it. The only thing you don't want to use is a strong degreaser product that has a real strong negative charge to it, but you can still do that. And let me mention this. I said earlier to somebody that if any of you are, I know you've studied, mitochondria and ATP and all that back in your days of training. And if anybody out there has used an ATP meter, it's interesting because we can take an ATP meter. We've gone into dental offices and just sampled around in operatories that have been cleaned and found pretty average. I mean, pretty often we're finding failure rates.
Wow.
That is after using your chemicals. And a lot of it's not because of staff, incompetence or anything. It's just that everybody's trying to spray and move and do it as fast as they can. But it's easy to go and find places and sample and find failure rates. And that means excessive levels of ATP, higher than it should be, meaning there's there's matter there. There's microbiology matter there. And it doesn't mean that it's good or bad bacteria, but there is bacteria there that should not be there, even in sterilization rooms. So that is something to think about, that this kind of helps remove error as you really apply it and you put it down, even if you use your conventional products. I just thought I'd throw that in.
Well, Jay, I think you just came up with an idea of a great commercial. I think that's a great idea. I might have to do that one day. Maybe I'll do I'll use my office as an example. I might just go, use conventional, cleaning products, and then maybe swipe something, send it to the lab, use your product, swipe something, send it to the lab. I think that'd be a cool commercial. What do you think, Jay?
Something you certainly could do. And what's really fun is to take an ATP meter into restaurants and sample tables and menus.
Oh gosh, so, I think if you did that, I'll stop going out to eat. I don't know about that. Might be a good thing though. But Jay, I want to say this. Thank you so much for jumping on, guys. For those who are watching, I'm going to talk to Jay offline here. We'll figure out a code for you guys to start getting these products. I'm super excited about this. And before we log off, Jay, I always like to give my guests kind of like the last word. And what do you want to say to all our doctors that are watching right now? What is your message to them?
Well, if I were to say anything, is that it's I think one thing beneficial is that we understand the field of dentistry because we've been in it so long, and we see the challenges of the profession. It's a very expensive profession to be in. The cost of running a practice, equipping operatories, marketing, keeping patients, it requires quite a commitment, and we really are highly interested in making the field of dentistry a major focus for our company and our technology. We see the need. It's a fun profession to work with because we're not talking about massive corporations. So it's something near and dear to our heart. And as I said, one of our partners is a very successful dentist.
Yeah,
so it's important to us.
Well, Jay, we are excited to have you on. We're excited to have you guys in the group. And guys, stay tuned. Keep typing in the comments section, germ-free there, and I'll be back with a code. But Jay, again, thank you so much. And everyone, thanks for tuning in. We'll see you guys later.
Thank you very much.